So as I said, thank you very much for coming along today. This DADx session is all about tackling inequalities, but particularly in rural areas. So we're going to talk about living in rural locations, in this case in the Highlands specifically, and then talk about dads who are facing kind of multiple barriers to support and what some of those issues are through Home-Start Caithness. But just to give you, oh, there we go. As I said before, I'm absolutely delighted actually to have Susan Ross from NHS Highland, Julian Bose, who was the founder of DadPad, who operate up in the Highlands, and Fiona Carlisle, who's the manager up in Home-Start Caithness. Fiona's got to get away fairly sharp at 3 o'clock, but Ian, who also works up in Home-Start Caithness, is here. So if you've got any questions for Fiona, I think Ian should be able to step in and answer any of those questions. And for that matter, so if you've got any questions or anything or comments or things that have occurred to you as we go through the presentations and talk about these issues, please just pop them in the chat. We should have about 10 or 15 minutes at the end of the session just to answer some of those questions and for you to have a talk to Julian and Susan and Ian and Fiona as well. So just to give you a kind of sense of some of the issues that face dads right up in the north of Scotland. First of all, just the remoteness of the Highlands. It's a really, really big area, as you can see on the map. It's very, very sparsely populated. In fact, it's the most sparsely populated region in the whole of the UK. There are just 12 people per square kilometre in the Highlands. That's compared to an average in Scotland of about 132. So it's just not very many people up there, which means providing services of any sort actually in that area becomes problematic just because of its rural location. So there's this kind of rural disadvantage just because of the size of the area, so the population density, but also how far lots of those areas are away from in Scotland, that kind of central belt where most of the services are clustered. There was a piece of work that was done by the Samaritans back in 2020 and it was actually 2022. I think it was the end of the pandemic actually. And it went out to people across the whole of the UK, and it showed that around 43% of men in rural areas are likely to reach out for support or to talk to someone if they're struggling with their mental health, compared to 51% in urban areas. So not only is there this kind of rural penalty because it's so sparsely populated and away from hubs that can provide provision, but actually just in terms of help seeking, this piece of research particularly showed that men are far less likely to seek help if they're in those rural areas. And this kind of sentiment is echoed in our DAD survey. So you may or may not know that we run an annual DAD survey. And this is some of the findings from back in 2024. And we asked dads a series of questions. These were two of our wildcard questions. So there are questions that we don't ask every year. One was asking about whether dads felt they were able to get involved in community activities with their children. And you'll see that 50% of dads in the Highlands said that they almost never or did not often get involved with community activities with their children, compared to 34% in the rest of Scotland. So you can see that dads just aren't as involved with their children's activities, and that may well be because they're living so far apart from other families and other services. We also asked dads whether they were able to connect with other parents, or they felt connected to other parents in their local community. And again, we can kind of see the same pattern that 75% of dads, so 3/4 of dads, said that they almost never or did not often feel connected with other parents in their local community, compared to 58% in Scotland. And it still is a shocking result for me, actually, across the whole of Scotland, that dads feel so disconnected to other parents in their area. But it's particularly acute in the Highlands. Poor mental health as well. We can see through our dad survey that dads struggle more with poor mental health in the Highlands. So 48% of the dads back in 2024 told us that their mental health was either poor or very poor. And that's compared to 58% in the Highlands. So quite a significant uptick in the Highlands back in 2024. So we can kind of see these inequalities both nationally and within our dad survey. For dads who told us that their mental health had deteriorated in the last 6 months, we asked them what kind of support they'd looked for or received within that time, within that 6 months. There's only 10 dads from the Highlands who reported that their mental health had deteriorated during that time. So it's quite a small number, actually. So we've got to be a bit cautious with these figures. But you can see actually that again that the dads in the Highlands seem less likely to go and speak to their GP than the average. So just 10% of dads went and spoke to a GP about their mental health, compared to 23% in Scotland. And sadly, none of the dads had contacted or received support from a mental health support group. So again, we're kind of seeing what we can see through the Samaritans piece of research is being mirrored in the dad survey that we took place. And probably most worryingly, I think, is that 20% of those dads whose mental health had deteriorated in 6 months, in the last 6 months, hadn't sought any kind of support at all. And that was compared to an average of 15% in the rest of Scotland. So we can kind of see that there's this gap between Scotland on average and the Highlands, both in terms of their connection to other parents and connection to other services and their mental health. I'm not going to labor on this for too long, but new dads, and I'm sure that Julian will talk a little bit more about this, are particularly at risk. And there's lots of reasons for that. So hormonal changes, if you've come along to any of my training or lots of my presentations, I talk a lot about hormonal changes during as men transition into fatherhood, and the gendered expectations and norms around becoming a father. And this kind of, often dads feel this tension of being torn between providing for their family, being that breadwinner, and also the emotional support that they feel as though they ought to be giving to both their partner and their child. And being a present father, this tension between providing and being there is a really significant problem for lots of dads. Also, just the lifestyle changes that men have to deal with, and of course mums as well: sleep deprivation, strain on family finances, changes in lifestyle, so on and so forth. And particularly within the Highland regions or rural communities, often dads, particularly if they're the first dad within their, or first men within their group, their circle of friends and the number of confidants that they have can really reduce at that time. So, if you're the first in a group of guys who is becoming a dad, all of a sudden your focus has to be on looking after mum and the child. And all of the other friends continue to go off and do whatever they want to do, and they're kind of stuck at home with their child, with often nobody to talk to. So these are all sort of considerations or issues around becoming a new dad. And we can see this in the literature or the research around new dads' mental health. As I said, you're probably know some of these statistics, but anxiety and depression are not unusual in men going through these big life transitions. Somewhere between 8 and 26% of men experience paternal perinatal depression, and that peaks usually about 3 to 6 months after the birth. Around 3 to 25% of men experience paternal perinatal anxiety, and that rises between 2 and 51% postnatally. So men tend to experience these issues far more after the birth of their child than before, whereas mums, it can be during pregnancy as well. Tends to be afterwards for dads. And if you're wondering why it's important, well, maternal and paternal depressions are interdependent. So if dads are struggling with depression and anxiety during that perinatal period, then it can impact on mums and vice versa. So if mum is struggling with her mental health during the pregnancy and thereafter, it can impact dad. And none of this, of course, is good for the newborn, the infant. And what does untreated paternal depression look like? So it can increase hostility and conflict in the home, particularly with the partner and spouse. It can increase feelings of resentment towards the baby. It can increase negative parenting and harsh discipline. And in terms of the child, it can impact on children's behavior, and it can increase emotional and conduct problems later on. Can also decrease, obviously, positive engagement with the infant. So that's less sensitivity, warmth, playfulness, touching, all that kind of stuff, and delay that attachment with a baby. Also, those positive interactions with other children. So the amount that dads might sing and read and play with that child may go down if he's suffering from paternal depression. And finally, so this is from our dad survey last year. We asked dads, when you're becoming a new dad, where did you go for advice and support to help you personally cope with this change to become a new dad? We asked a series of questions around this, but interestingly, 45% said that they almost always or often went to see their partner. That was closely followed by families and friends. But as you can see, community groups and statutory services were certainly areas that dads didn't tend to look for help and support. So 84% said that they never or did not often seek support from community groups. 77% said that they did not seek that advice or support through statutory services. And of course, this is across the whole of Scotland and not specifically to Highlands. And I suppose, in a way, it really struck me when I saw this because I thought, actually, NHS Highlands and actually all the third sector services around NHS Highlands and in the Highlands area, I think is really doing a huge amount of work to improve these statistics, actually, and to engage fathers uh, or really strive to engage fathers just during this period and support them through this difficult transition, and all obviously for the benefit not only of the dads but for their partners and for the children. So I'm going to draw breath now and pass over to Susan Ross. So, Susan, I was trying to think back actually, Susan, to when we started getting involved with NHS Highlands, but I think it's as far back as 2021. Am I right there-ish? So it wasn't me; it
Yeah,
was Chris Visitors, I think,
yeah.
who I worked with for a long time, and actually is still part of our board. So, I'm gonna. Shall I stop sharing or do you want me to just go through these slides for you?
I'm happy for you to go through if that's okay.
Sure. Okay. So I'm going to pass over and thanks, Susan, very much for coming along and just talking about you, your experience of engaging fathers.
Thank you, Kathy. Thank you. Hi, everyone. My name's Susan Ross. I'm the perinatal mental health advanced nurse for the team who are the perinatal infant mental health team in Highland. My colleague Donna Cowan was supposed to be alongside me today, but unfortunately she has not been able to attend today, so it's just me. So we began in 2021, and I say when we began, it was myself that came into post first in November 2021. And I remember when I first started, I was put into a room and left for the day and said, there you are, off you go, develop the perinatal mental health team. So over time, we had Donna came in after myself, and then Roddy came in after Donna, and we've kind of had a staggered approach of all the staff that have come into the team. And one of the first things that we were doing when we had that little kind of period, I suppose it's a kind of grace period of developing the team, was looking at predominantly it's referrals for mums. Well, it is referrals for mums that come into the team, but we were very much aware of kind of looking at the family unit, and that being partners, dads, and then that wider family as well that all supports and gets impacted with maternal mental health. Thank you, Kathy. So we kind of work from the Women and Families Maternal Mental Health Pledge, the Voice of the Infant Best Practice Guidelines, and the Paternal Perinatal Mental Health Review. And it's looking at all these documents and guidance and working kind of from our principles as a team, kind of moving forward. And that involves, working and thinking about dads and partners when we're assessing and treating mums and birthing people. And it's looking at these kind of individual documents and reviews and kind of pulling out what is it that we should be looking at, what is it that dads and partners are looking for, and from an infant's point of view, when we're always kind of thinking from, if we look at it through the eyes of an infant, what are they seeing? What should we be? We can't be supporting family members kind of individually. It's having that kind of holistic care and having that kind of multidisciplinary team approach. And with that, we work closely with our health and social care partners, but we also work really closely linking with our third sector partners as well. And that all kind of contributes towards these three documents that we take our principles from. So why do we focus on dads to be and new dads? So within Highland, we've got to consider the challenges of accessing services, organisations and professionals. Like Kathy was saying, it's very remote and rural, and people are very, very kind of widely spread. We've got to think of the distance people have to travel, the job roles, when we're looking at agriculture, hospitality, armed forces, fishing, all these different roles that dads can be in for a lot of hours during the day when it's very, very busy periods. And then again, that kind of transition when dads come home from jobs and they might be home for a few weeks or they might be home for a few hours. The isolation that can cause, and not just within kind of locally, but within their kind of work environment as well. Paternity leave, if they're self-employed or working for different organisations, it's a very, very limited paternity leave, if any, that some dads will get. And again, family support, what we're seeing is that what used to be when there was very, very small communities of family, a lot of the families lived together, or there was a lot of families that had that kind of wider family support, that is becoming less. And or families may be wider, kind of spread out if you're looking at kind of housing, jobs, things like that. You'll see that families kind of move away from that kind of family support as well. And it's important that for us as a team, that we've got that support from that wider family and dad or partner, when we're supporting mums and birthing people, when we're assessing or providing treatment and intervention and care, that we've got that wider support as well. The stigma that goes around paternal mental health, and I think there's still a lot of stigma around mental health. So if we're kind of even focusing it more so on paternal mental health, then that's a topic that doesn't get discussed an awful lot. And then seeking connection with other dads. I think that's a huge thing. Again, what you'll find is with a lot of groups that it's mum that comes along, dad might be working, or that dad doesn't feel that that's something for him to go along to. There's not other dads there, so he feels a bit kind of isolated with that as well. Or there's no groups. There's some places that just don't have groups or have organisations that run different things in that areas. So again, we were thinking about how do we improve that? How do we some kind of step away from that kind of traditional outlook on what you can get parents involved in, and specifically dads as well. So what have we done since we've come into post as a team? So from the outset, we've engaged with our health and social care and third sector partner organisations to support families. We've ensured the voice of lived experience was included in service development, and through liaison with the mental health campaigner Mark Williams, who's probably the first person that I spoke to, along with Chris, and organisations such as Home-Start, PEEP and Dad's Rock, as well as Fathers Network Scotland. So we hold a triannual lived experience forum, which Donna chairs, and then everyone comes together just to kind of share where we're all at, what's happening, what do we need to take forward. And it's a really, really lovely forum, just to hear everybody and what everyone's doing and what we need to take forward. So we introduced ourselves to Chris of Fathers Network Scotland at the time in December 2021. So that was a month after I came into post, and then Donna was just newly in post as well. And we virtually met in January 2022. And following on from this, we undertook, so this was a team at the time, undertook the Understanding Paternal Mental Health training in August 2022. So we really enjoyed this, and Chris came up to Highland and did it, and there was only a small group of us at the time, and we found it really valuable. So we actually organised 2 further training sessions of the training, which Chris facilitated, and that was spread out over everyone, health, social care and third sector within Highland to attend, and it was really, really well attended. Scott Mayer then kind of came in to post, or came in and kind of linked in with the team in August, September 2022, and then we did 4 further training sessions were held as well. And we continue to work closely with Fathers Network Scotland alongside Kathy. Dad's Rock, so we've been promoting remote and rural peer support work and ongoing contact with Maddie and Greg from Dad's Rock. So we link in with them, and again try and just kind of raise that awareness and say, raise the kind of awareness that there is peer support out there for remote and rural dads. And we have had some dads that have linked into that. We've worked alongside Home-Start Caithness and East Highland. So again, we'll do referrals from our parents into Home-Start, and it's great just to kind of get what's going on, developing different things, encouraging kind of funding if there's kind of funding available and things as well, and which can be really difficult. And I think that's really important that we continue to get funding for these organisations as well, to support the parents within Highland. Crossreach now offer a perinatal mental health counselling hub in Highland, and that is open to dads as well. And that is up until infants, it's actually 3rd birthday. And parents can self-refer to that, or they can be referred as well. But that's another really useful service, and at times they've had to kind of close and put on a waiting list, or they've got a waiting list and then they've had to kind of close for a short time till they get through the waiting list. So it just shows you the demand that's there, and they're really promoting dads to attend those counselling sessions. And I think sometimes dads find that helpful because it's not a statutory service, which can be a bit more difficult. So it is a charity based organisation, which I think dads sometimes feel a bit more relaxed with. So in May 2022, I attended a Southeast Perinatal Mental Health Services webinar. So that was based down in England. And it was focusing on fathers and partners. And this is where I heard about DadPad. So I came away from that webinar going, oh, this is new, and why don't we have something like that up in Highland? So when we did a wee bit of research about it, and we got in touch with Julian, that was in August 2022. We started discussions to commission DadPad, and in October 2022, we'd signed the agreement, and we were the first in Scotland to officially launch in April 2024. There was a lot of work involved with that because we had to basically kind of do all the links for Scotland, and then we had to do all the kind of details for Highland as well. And there's a lot of things in England that aren't available up in Scotland, and the kind of differences as well. So there was a lot of work that was involved in that, and alongside DadPad, who were amazing, obviously kind of supporting us with that. So 2024 we kicked off. We had a launch. Everyone was invited to come along. It was supposed to be a bigger launch, but we had to kind of scale down due to money. And Julian came up and did the promotion for that as well. And all our midwives and health visitors promote it. The midwives at each appointment will speak to mums and talk to them about DadPad, and obviously speak to dads when dads are present at appointments as well. So in 2025, we started kind of discussions with our local obstetric ultrasound scanning department, and Julian kind of linked in with them to start promoting DadPad, as we know, because that's the most attended appointment by dads and birthing partners, is at the scans. So I think we've done really well. That our downloads have increased through that as well, and dads are really kind of engaging with the app. There is obviously the books as well, which we do hand out, and some dads and mums, I have to say, have found that really useful as well. And all our midwifery, FMPs, and health visiting teams all have access to the various pads that are available. So within the team, we also there was the icon rollout kind of nationally, and Donna and our partner colleague down in Argyll and Bute did an inconsolable crime webinar. And that again has been really useful, and kind of linking that in with kind of parents and dads. And the icon is also in DadPad, so Highland were kind of advanced and ahead with regards to that kind of promotion as well. And then in September, October, and November 2023, we ran 3 pilot sessions of figuring out fatherhood with Scott at Fathers Network Scotland. And these were really well attended and received excellent feedback. The dads really enjoyed this, and they were just delighted that there was something for them that they could access within Highland. And then in 2024, we held a further understanding paternal mental health training session, and that went down really well as well. That was really well attended. Then so last year, we had our first anniversary newsletter that we dedicated to dads. So this from the team. So this goes out to all health and social care professionals and third sector organisations. And that was just, again, to kind of promote DadPad, Fathers Network Scotland, Dad Rocks, all those organisations, Home-Start, all the organisations that are there promoting dads, mental health and what's accessible to them, and what we hope to kind of continue doing as well. Dads or dads to be in Inverness prison also have access to DadPad books as well. And the team run pamper sessions, which are sessions for healthcare professional or a social care professional and third sector to come along and speak about any level of paternal or maternal mental illness. So we've had professionals that have come along and spoken specifically about dads and what's accessible, what's available for them, which they found really useful as well. Thank you. So these are just some photos of basically all different corners of Highland, of where our DadPad is promoted within the different units and within the different bases. That was our little promotion one down the bottom with the cake, and DadPad, so that the signs, the books are all over Highland within the different bases. So that was just a little photograph that everyone kind of sent us when we kind of sent banners round, and we did the promotion again, kind of promoted it again last year. And that was probably really speedy.
That was great. That's great. And if anybody's got any questions, we'll come to that at the end for Susan. But it's probably quite a good time to hand over to Julian very quickly, just to talk about your experience of bringing DadPad up to the Highlands.
Thank you. I hope you can hear me. Can you see me as well? Yeah. Oh, fab. Hi, everybody. Thank you for coming and listening to me today. It's been great working with Susan and the Highlands team. We've really tried to bring my 15 years of working in this sector and passionately, honestly, passionately, to try and ensure that it's not lip service, you know, that we have a way to really put front and center fathers help as possible in their kind of transition to parenthood, so that they're prepared, forewarned, armed, get involved. And I think despite the perfect storm, or actually because of the perfect storm that Kathy described, rural area, we have practical barriers, we have emotional barriers, we have an understanding of where fathers finding it.
Oh, seem to be having a few problems with Julian's connection. Connor, are you having the same problem?
Yeah.
Sounds like he's dropped out for a minute. Maybe we'll come back to Julian in a second. Sorry, Julian. And we'll go head on over to Fiona, if that's all right, Fiona.
Yeah. Hi, everyone.
Is it worth me, Fiona, before I hand over to you properly, is it worth just kind of just providing a little bit of context around Caithness? I won't kind of talk about this too much, because no doubt Fiona will talk about it. She knows it far better than me. But just to give you an idea, this is a map of where Caithness is, and it was I didn't realize how flipping far away it was until I had to drive up there from East Lothian. At the end of last year, it's a really long way from Inverness, that's for sure. And in terms of population density, there's just 5 people per square kilometre up in Caithness, and that's compared to 12 people in the Highlands. So as I said, it's a really, really long way from Inverness, about 2 hours by car. Is this right? 3 hours by bus, Fiona?
Yeah, you would, on a good day, yeah, you know, just now, because it's it's that seasons, the tourist season starting to increase. You could be 3.5 hours easy, and in the winter that again you can be cut off because we're the only road in and out of the A9. So sometimes it can feel like you are an island, even though you're not, because of the disparity and the geographical area of where we are.
And also the other thing that struck me, and certainly coming up to see you, was the level of deprivation in that area. So 11% of the population were identified as being income deprived in 2020, and 9.6% of the working age population were unemployed, unemployment deprived, so wanting to work but unable to do so for various different reasons. So it really struck me actually when I came up to you, and I didn't quite appreciate how remote it was and the difficulties that men faced in that area. I won't dwell on these particularly, but just that I had a look at some of the statistics around suicide and drug misuse up in Highlands, and it was significantly higher for men in the Highlands. And obviously socioeconomic factors drive deaths of despair and suicidality. And these are some of the issues that certainly talking to you and coming up and seeing you were really prevalent for you. And I'm kind of hoping that you might touch on some of those issues that you see, some of those kind of acute issues that you see up in Caithness. I won't necessarily go into that, but we'll share the slides with everybody. But also, you know, quite a lot of the men that you see were sharing care or had total care over their children, or their family circumstances were quite fluid and quite changeable. And actually, there's a lot of issue around that, I suppose. And yeah, it really struck me actually what an awful lot of kind of sort of overlapping issues that you had to contend with actually, and in such a very, very rural area. So I'll pass over to you to tell us a bit more about what you're doing.
Well, so thank you, everybody. And here we go. Can everybody see this presentation okay? Yeah, perfect. So that's a good start then. So my name's Fiona. Obviously, I'm the manager from Home-Start, and really today, you know, obviously Kathy and Susan have touched on some of the support that's available in the Highlands already, but I kind of just wanted to highlight some of the support that we do primarily within Home-Start Caithness. As Kathy sort of touched on, we are really rural, which comes with lots of complexities. And our support, Home-Start itself provides support to children in their early years. And we take that approach that it's like a whole family approach. So we don't just support mum or the children. We're looking at that whole holistic lens of how do we support the family. And dads have always been part of that. And our support to that has grown over the years, and we link in with a lot of other services to make that happen. I was going to say just ask questions as you go, but I think Kathy's keen to keep them to the end. But if there's anything particularly like pressing, just chip in. I don't get too fussed about being interrupted. So the aims of the project, we'd always given that home visiting support to the whole family and dads. But as sort of time went on, families, primarily dads, would tell us that these were some of the things that they needed from support. So they needed someone to walk alongside them, offer that understanding and guidance, and the consistent support. So always being there. What dads told us is that they wanted to feel more confident in their parenting. And how did they do that? So we use tools and strategies, and often just reassurance and kindness to dads. The tools come from some of the really good things that's been mentioned today, like DadPad, Icon, Dad's Rocks, the counselling sessions, PEEP, Father's Network, Dads Matter. These are all services that we wrap around ourselves, right? So we always say we're the bridge to those services. We walk alongside dads to get them to those services, because we don't claim to be the expert in everything, but by having somebody walk alongside you, that journey or that acceptance of support is much, much easier. So that's where connection comes in. Dads will tell us that having that safe space, having a connection, someone that they can share with, and somebody that fully understands the circumstances and doesn't judge either way. So that's one of the biggest things, I think, as a service and as a service manager, I have often had to overcome, is that we treat dads and parents and families all with the same respect. It's not up for me to decide who gets support and who doesn't. What it is for us to do as a third sector organisation is to bring people together, reduce the barriers, and make support available to everybody. So some of the key elements that come up as barriers for families is one, and we've touched on a few of these already in the presentations from other people, but distance, rurally, how long it takes to get everywhere, the lack of services that might be available, limited childcare. We have very little childcare options. And then there is some of the more complex things is stigma, fear of being judged. We live in a very small community, so it's really hard to keep private situations private, and often that becomes then difficult for dads to reach in and get support. That then puts that extra pressure and challenges on families. So that's why we created some of our support to be their dad support groups, that they're really private, non-judgmental, but they are open to everybody, but they're focused and led with the dads. So they co-design and co-deliver the services to make sure it's exactly what they need. It's not designed by our service, it's designed by the dads with the lived experience and the passion and the kindness that they bring to each dad. So they bring that support in, and that makes a huge difference to the dad's journey within Home-Start. So the way that we approach some of those barriers is that person-centered. So every single dad that comes into us gets that unique experience. It's not a one-fit-all, and one-stop shop type thing. We don't decide how long somebody should be within our service. We don't decide what support might look like for them. We mold our service based on what that person or that dad tells us that they need. It's strength-based, so we work on the strengths that the dads are already bringing to their families, and we build on that, because it is about building their confidence and empowering them to be the dad that they really want to be. And some of that's done in different ways. So some of the dads get home visiting support, either by a staff member or a volunteer. And some only come to our dad-only space, which is a beautiful space that's been created and, as I said, co-designed and co-delivered by the dads. They share experiences, and that reduces that isolation. Often living in a rural area, we are the only dads group in the area, in the whole of Caithness and parts of Sutherland. So it's really important that that service continues to run. And I think Susan may have touched on it earlier. We are a third sector organisation, so we rely fully on funding from services to allow us to do that. The most important thing that we're trying to do is strengthen relationships, reduce that isolation, and allow dads to feel connected and supported and confident in their ability. Often dads will tell us that they don't know how to be a father, or they've not had good experiences themselves or role models. So that's some of the things that we offer. Our dads group is run by a dad and a male, and our volunteers that help out are also males, because we've tried to create that space that is a male space so that they feel completely safe to have those open conversations and lean in on each other. What we offer within those groups is different things. So every week it can be different. So the dads have done a mixture of different things, from cooking to woodwork to gardening. Some of them are parent-focused sessions, so they look at BookBug, Child Smile, Peep, and then we use like interventions. So that would be, the frameworks would be Parents Under Pressure or Mellow Parenting. And these are designed and offered so that it reduces some of the barriers, or gives dads that skill set that they may not have, and work on some of the challenges that they might be facing. We run events for families so that dads can come along and meet other families, and that just creates that opportunity to be around other dads, but also other families, and create those connections. We do outreach support. So yes, we have groups in Wick and Thurso, but in our much rural areas up west, we do pop-up sessions so that dads can still access that. And we have the digital offer as well in case work gets in the way. Again, we touched on the resources and tailored support. We would signpost all those services that are available. What do dads tell us that's really important about their support? So the dads that we currently have will tell us that a small welcoming group or a space that they can share their experiences is what's really important to them. They need to feel more confident about their abilities, not being judged, and just having somebody there who can listen to them. And also that proactive approach, giving them the confidence to try new things, having those really challenging conversations when things feel tricky, but equally knowing that that is a space that they can always come back to and there's no judgment from it. What we as a service have learned is that there's daily pressures on dads all the time to manage the families, to manage their finances. Often dads, as Kathy touched on, mental health is affected by being so isolated. Dads often, and this is a phrase that gets said to me often, is that they feel they're the only one really dealing with those challenges. And that's where peer support comes in. It's really important having that group space where a dad can bring something to it and say, this is how I feel. Other dads can relate to that, but equally reassure them that they're not alone in their thought process or their situation, relationship breakdowns as well. So we have lots of dads that come into our support that are separated or co-parenting, and that brings significant pressure. And again, in a really rural area, that can also bring extra complexities. So having that calm, neutral, non-judgmental place for dads to come to with their children and know that that's a space where we're not judging, we're just here to make sure that the child is getting the best experience that they can. And we provide the same experiences for those dads as we would do as if it was mum and if they're separated. And equally, we support both mum and dad just separately if they're not together. We also take into consideration past trauma and their experiences, and that's underpinned by the promise. And it's important for dads to understand the impact of trauma and what that might mean for them and how that can affect their parenting. Often Ian, who runs the dad group, I think recently have started taking core activities or core topics to it and said, what's your childhood like? What was really good in your childhood and what wasn't so good? And how have you managed to adapt that? And then we can then better understand how to support dads. I'm, as I said before, I'm really passionate about not telling dads what they need, but trying to break down those barriers and find solutions for dads, so that they can be the dad that they really want to be. Often as well, something that Kathy touched on earlier is drug and alcohol. Within our community, drug and alcohol and mental health are some of the biggest barriers that dads are facing. They're using them to reduce the stress, isolation, self-medicating. And again, it's not for us to judge dads when they're in that situation. It's about us being the bridge to services so that we can get them help at the right time from the right people. As Susan touched on, we use the perinatal service a lot and cross-reach it for counselling. We know that if we can get early interventional support in right from the beginning, we can really change that direction that dads go in and what that might look like for ultimately the child. So we do have some practical things that we do. So we've created support bags that they can take to the hospital. We would use like DadPad, Icon. We do social stories around Rigmore and what that might look like. We do some of the practical things like making sure they've got accommodation and enough, that we reduce that financial barrier, and we're digitally there to support them. And we also reach out to other services in the area if we can't be there, and we're really flexible about that support and what that might look like. And again, it's about us not being judgmental. It's about reducing that stress and promoting that early bonding and attachment, so that dads feel much more part of the process rather than disconnected. And we reassure them right from the beginning, from conception through to birth, on things that might be coming up or might become a challenge for both mum and dad. The difference that consistent non-judgmental support makes for dads. So this is the thing that I am super passionate about, is that if we want dads to be part of children's journey and we want them to feel more included, then we need to listen to some of those things that dads are bringing to us. So having early interventional support, making sure that they get access to services when relationships break down, being aware of families that are care experienced, being aware of that trauma and being trauma informed in our approach, reducing some of that social economical factors for dads, and reducing the isolation that brings, so that we can react early or respond early, rather than waiting for crisis. Things that with the right support at the right time, dads, it can stop them self-medicating or having to use drug and alcohol as a clutch. They begin, they're more present for their children, and they can help be part of that routines and confidence. Some of the things that we have identified during our support time is that we had dads that were taking drugs and alcohol. We have had dads that have now become the primary carer of their children. They then become the main carer in their family dynamics. We've had children that were previously on the child protection register and they've been removed. And what this entails is that it helps that dad to become empowered, to be the parent that they've always wanted to be, but also have that underlying skill set to be able to continue to grow as a parent. And Home-Start provides that trusted belief and consistency that allows that parent to know that, or that dad to know, that we're here no matter what their journey entails. And I think that's really important. That's something that dads feed back to us all the time, is that they know that we will continue to be there regardless of what's going on in their family dynamics. These were just some of, so throughout there's been photographs in the presentation, and they're all dads within our support. And I'm proud of every one of those dads, because they're actively involved in their children's lives, but they're actively involved in seeking support and being a better parent. And ultimately, that's what we want for every family that comes into Home-Start. These are some of the quotes that families, or some of the quotes that dads gave us. And I'll just read some of them out. But I've never had support without judgment before. Home-Start stuck with me and believed in me, and it made me believe I was a good dad. So that comes up a lot, that dads feel judged by their lack of being there, or there may be social economical factors. For us, we just see a dad. We don't see any of the other barriers. It's about us empowering those dads. And group helped me realize I'm not the only dad struggling. Yeah, touched on that before. That's what's so good about the group support, is that they have that opportunity to share and pull their lived experience into it. I used to feel like I was failing, and now I feel like I'm the dad my kids can rely on. I think that's really important, that we know that by a dad feeling more empowered, that supports that family unit. I'm not afraid to ask for help anymore. I think that's really important, especially in our community. There's a real stigma about asking for support, and hopefully everybody that attends our support or is our group doesn't feel that way. I look forward to group every week. I hear this all the time. They'll be like, "Oh, don't cancel group this week." If we've got a training session on, the dads will often, come up with solutions, and they'll go and meet on their own. They'll go out for breakfast together. They've made friendships together because the group is something they really look forward to. And one of the feedback is that they really enjoy that cooking sessions, so that they can meet their children's needs and create healthy meals. So these are just some of the snippets. about Dad's group and Dad's support. But as I said, thank you so much for taking the time to listen to our presentation today. I have my colleague Ian on the call with me, and he actually runs Dad's group. And that's where all the credit goes to. I'm just here to do the presentation, but equally my colleague Ian and Moira really take responsibility for providing that wonderful holistic support to dads. And hopefully if they have any questions, they'll be able to answer them all for you. And on that note, thank you so much for listening to my presentation today.
Thank you so much, Fiona. Honestly, every time I speak to you, first of all, I always think, I know all this, but honestly, every time I think I've learned something new, and you make me see things in a different way, and you're so inspiring. And genuinely, what you're doing up in Caithness in one of the most, hard to reach areas is just astonishing. And I'm going to look forward to talking to Ian a little bit more, and hopefully others on the call will want to pick your team's brain. But thank you so much, Fiona. I know you need to rush off, but thank you so much. Honestly, it's lovely, lovely to see you again, and really appreciate all your time. Before we go on, sorry, Fiona.
No, I was just saying thank you so much. And to be fair, I can't take credit for it, because it's the dads that come into our support that are the big drivers on it. But equally, the staff that I have around me are equally passionate about making sure that dads are included and their voices heard. So it makes my job easy. But yeah, I do, and I'm surrounded by professionals and other services that equally want to make that difference. So that makes it, in the Highlands, we are lucky that there's lots of people striving to try and make that difference and include dads. So yeah, I feel very privileged to be able to present that information.
Thanks ever so much, Fiona. Before we get on to questions for the panelists, we're going to try and hand back. If I feel like a football pundit now, I'm going to try and hand back to Julian. If you're around, Julian.
Yeah, I'm here. Can you see me? Just very quickly, so because I know that you want to have time for questions, but obviously, how inspiring is that when we've got services just a little bit downstream when the baby's being born, where you've got Ian and his father-facing kind of groups and curiosity and that learning loop going on. And you've got an organisation such as Home-Start, which links into all those other activities that are really there, built for those dads to have a passion for being that role model for that baby that they're trying to bring up. What I want to understand is why we all as a system haven't got that. Why haven't we got that from the very first contact? Why don't we have that in society where men know, as they do in other countries? There are some countries in Scandinavia, whole community is set up to know when a man becomes a dad, or a partner becomes a parent, and mother becomes a mother. They kind of instinctively know what to do. They know how to treat these new men becoming new people and new parents. They treat them like they know that they're vulnerable, that they know their life's going to change, and that they need extra support. This is where I came from, and I'm an ex-probation officer. I used to see it when families used to go wrong right at the other end. And just as I came towards the end of my probation career, working with these men in a group room for 15 years, running dads groups and speaking to dads and doing all this 15, 20 years ago as well, I developed these guides to make sure the system's got something to show pictures of these men doing the things that they could do to be the role models. And you've heard from Susan, and you've heard from others talk about DadPad, and Fiona talk about DadPad. There's the app version. We're just trying to get them something really early in the system that shows them all the wonderful things they can do to have that bonding and attachment, to show where the services are. Actually trying to get them to understand that this system is for them as well, that we are welcoming. And that's what the group is. That's what Susan in the Highlands have made her teams do, made them welcoming. I don't want to say Matt, we're making a welcoming Matt, but men into fatherhood. The challenge is about culture shift. The challenge is about marketing. The challenge is about visibility. The challenge is about listening to the voices of the fathers in real time as they're going through things. And I don't think we've got enough of that. We've just heard from Fiona that where she has a system where they can hear what the barriers are, whether they're practical, emotional, about changing how and where the fathers think they need to seek support. It's an exercise in trying to get communities to really explain the why to everyone, why they need a baby looking up at those mothers and fathers and partners, looking at them as stable as they can be, as together as they can be, as equal and shared care as they can be, because we know what problems build up. And I think Fiona talked about the crisis that we're trying to avert, we're trying to prevent, we're trying to be preventative and be proactive. So when I developed DadPad, and we're in 60 plus areas in the UK, we're in the Highlands. I'm trying to develop some more tech for neonatal as well, neonatal babies. Just imagine those fathers of those babies into neonatal units for the first time, and then traveling back to kind of rurality. How they're far from the support that they require from services, but they can be really isolated. Those statistics around the sparseness of the population, they could be miles from the nearest other neonatal father that they could talk to. So we want to try and make sure they're providing some way of talking to each other, finding out what services are available in the locality in Scotland, wherever they are, whether in the Highlands or in any part of Scotland, but in particular those rural dads who have been conversing on our DadPad app in the Highlands a lot about, I'm going to go to the hospital. Where do I stay overnight? Where do I do? They ask the questions that need to be asked. And it kind of backs up the fact that they're reaching out and they want to be there. So despite that perfect storm you talked about, and perhaps because of it, I don't see, when I look at the findings of the report that just came out, I don't see fathers who are disengaged. They'll become engaged if we engage them. I think that's the point. They want to be there. They're trying their best whilst they're facing, navigating work pressures, financial pressures, the changing expectations of fatherhood. They're not blind to the fact that life is so fast paced, but the pressure is mounting on them to actually keep it all in and try and ride it through, just because they don't know whether they don't want to put it onto the mums because mum might be struggling. It's something they're tackling alone at the minute. We've really got to allow them to tackle it together with the Home-Starts, with the perinatal mental health teams, with all the associated organisations who can be there to kind of walk alongside them. But sometimes we don't tell them about these things until it's a bit late. Many fathers don't know what support is available. So through our app, and I appreciate Susan after the cake, it was a lot of work, but we made sure that they could see what all the support was right from the very first scan. So Jocelyn, Susan and Donna hooked me up with Jocelyn. Jocelyn then said, right, I'm going to make sure that we put a sticker on and we get them onto the DadPad app as soon as they come in for the appointment, because 90+% of dads turn up to the scan. Most of the dads, if they come to a scan and we don't talk to them then, we don't recognize that as a legitimate start of their journey, they go home and they start to think, well, I'm excited, but a few days later kick in when the reality kicks in. They're looking around and think, well, what do I do about this? What am I supposed to be doing? And then that starts the questioning of the mum, the thinking about how they were parented, and potentially not exactly the right footprint. They've got to feel that there's something that answers their questions. And that's why we try and come in. We created it with dads, for dads, with professionals and local. We can carry on doing that. So I would like to reach out if anyone thinks, because we're working with a few family nurse partnerships, obviously the ones in Highlands. And we're trying to make sure that whoever has contacts with those dads has got some way of doing that engagement with a physical guide, just sitting alongside, whether it be going through some of the support options that are available, helping the signposting, forwarding them to organisations like Home-Start, forward them to the perinatal mental health service so that they can see the bios of those, go through to referral forms, refer themselves. On the community groups, we had a great example of how I think Scott had his FOF groups on the go. So we put into the group that there's this, in all of the little pop-up groups that were coming along, they talked about first time dad group. We said, well, if you've got first time dad, there's this group coming next week, it's free, blah, blah, blah. And then from that, spaces can fill up. So you've got a way of showing them stuff a lot earlier. And I think that's what I'm trying to present is there's a whole load of men that might not get to walk through a door of a great organization or get to see an organization. And partly it's because we don't know who they are. We're not engaging them early enough. They are quite invisible. And it needs to be not only Scotland, it needs to be kind of across the UK where we make it that, you know, your local football teams, rugby teams, they all understand the environment we're trying to grow our role model men in. And it can only do good for the society and the communities in which we live. Time-wise, I think I probably should stop. Just get back in touch with me if you want to talk about DadPad and how it can come. It's not expensive. It's just a few thousand guides, 4-year app license. We'll work with you, get it into wherever, and it'll be local for you, and we'll report back to you on all its usage. So, and it's about co-creation and working with all the organisations that are so wonderful that you have, and growing some new ones. So when the dads tell us in real time from -9 months to 0, what's actually happening to them, because these are the ones that are really hard to see. But when they give us that information, I can then give it to you and share it out, and we can start to build interventions that are even more preventative. So that's what we're trying to make sure we achieve. Thank you, Kathy. I noticed a hand
Julian.
up, which was my cue to stop.
Thanks ever so much, and thanks for bearing with us and coming back to have a discussion about DadPad. And as you said, I think what's critical is getting in as early as possible. I think that early intervention, and also the point that you made about, and what sort of amazes me about the Highlands actually is how well connected you are for such a kind of, considering it's so spread out, how well networked and what a kind of community you all the professionals have. And I think that then that spills out and into the families within those areas. So despite it seeming like quite a kind of dissipated kind of population, you're so incredibly well networked actually, and incredibly forward thinking, I think, actually, particularly with dads. It's sort of extraordinary to me. Charlene, you've got your hand up and you've been waiting very patiently.
Hi, can everyone hear me?
Yes.
Yes, it's really a question for Julian, to be honest. I had put in a couple of questions when he was speaking about DadPad and how it's offered in those in custody in HMP Inverness. How is that? Maybe he's not the right person. Maybe it's somebody in NHS Inverness or Argyll and Bute that would know the answer to that. But I work for Early Years Scotland, and we deliver a father's programme and Learning Together Through Play sessions within a number of prisons across Scotland. And I think collaborating with the DadPad and kind of getting some kind of information and then being able to give that to dads who are maybe going to be liberated, just as to carry on with that might be something that we could work together with. And I think that's a great opportunity because the majority of men in custody, that's a real challenge, and it's such a difficult thing for them to discuss emotions anyway.
Absolutely.
The layer of being in prison and having to wear masks, and a mask when you're in the hall, a mask when you're in your cell, and then another mask when you come over and meet your family. And the the amount of times that we've helped to get dads reunited with their children, and then to carry on that positive parenting out with.
Absolutely. Okay, I applaud your efforts to do that. I mean, just very briefly, so short story, I used to train social care individuals. I used to take dads along to explain to them, how can these men know how to act and be a father if we're not showing them? Hence why we do the dads groups, hence why we do DadPad. In prisons, it's exactly the same. These men have had really poor father role models. They may have a change in behavior, and they might have been working rehabilitation, but at the same time, how are we skilling them up to make sure that they can prove in contact centres or to magistrates, judges, etc., advocates, that they're able to care for their baby? So Susan, I think, has got the contacts, I'm sure, as to how the DadPads were delivered to the prison services. I know it's a unique challenge. You know, some prisons in the UK don't even have a learning centre, working computers, etc. And DadPads weren't allowed in because it might have been used as a weapon in one of them. But at the same time, there are educational programs that use them. So it is about understanding if they can use them in Scotland, where you are, then there is a way to get them to them.
That's great. So is that something that if I passed on your email address, contact details to like my line manager and the CEO of Early Years Scotland, because we go in and do a father's program, so it's like a parenting program, and we're all trained ECPs. I'm actually a primary school teacher myself, and it's like I've done a lot of research. I've actually done a master's on the program itself, and so I know all the background, you know, to fatherhood, and obviously, you know, we're trying to change that, the parenting styles, because quite a lot of the guys will come along and be like, "I didn't know you could parent another way," because we learn from our parents.
Yeah, exactly. It's all from back here. We totally get it. Now, I'm thinking, because of time, I think there's an answer to your question. Gillian Forbes, PEAK coordinator, can speak to Tara, FCO, in prison for you. And the email is there in the chat, if you can see that, Charlene. And then maybe you can kickstart that. Any problems, you can get back to me or Susan, and whoever will find out for you.
Thanks, Julian.
Is your contact details, would you mind putting them in the chat so that I can just write them down?
Yeah, I've put mine as well there. If you look up at this, says julian@thedadpad.co.uk.
Oh yes, I see that. That's fine. Thank you so much.
No problem.
Thank you.
Thanks, Julian. Thanks, Charlene, for your question. I'm just slightly conscious of time. We're just about coming up to 1:15, which is when we would stop. But if you've got questions, please do stay on. We'll maybe keep chatting for another 5 or 10 more minutes, because it sounds like there's some good questions coming up. So if you do need to rush off, if you could just spend a couple of minutes filling in our evaluation form, which I think that Connor's just put in the chat. But for those of you that want to just stay on and speak to Susan or Julian or Ian from Home-Start Caithness, I've certainly got some questions for them. Please do stay on maybe for another five or so minutes. Carrie Hayworth, you've been very patient with your hand up, but who's your question for? Oh, sorry, you're on mute, Carrie. Oh. Sorry, Carrie. You seem to be on mute.
Oh, mic issue, she's saying.
Oh, okay.
Type a question in if you like.
Yeah, pop your question in the chat, and I'll ask whoever it is. While we're waiting for Carrie, I was just wondering. Actually, it's really for Susan and for Ian. What do you think, and maybe Julian as well, actually, all of you, what do you think others in rural locations, if you had to pick one thing out, what others could learn from you? Because I do think that you're kind of a shining example of supporting dads in rural locations. And I'm just wondering if you could kind of pick out one thing that you think, actually, this is a really, really useful piece of advice for third sector and universal services who want to support and connect with dads in those areas. What would you do? Ian,
just very quickly. Oh, sorry. I was going to say my quick line, and then everyone else can have a go. Early engagement to make sure they don't feel isolated and starts their journey. That's it. I want them. That's what I need them to do.
So right at the start. So catch them right at the beginning of their
so that
journey.
They know that they're supposed to, and there's stuff and there's people they can see. And that stops the isolation starting when they go home on their own.
Absolutely.
You don't want them to go home on your own.
That's great. That's really, really useful, actually. Yeah, engage them right at the start of their journey. Because as she said, if you don't engage them at that point, then you can get all the way to nursery and primary school, and you're like,
overwhelm them.
Yeah.
Yeah.
Same question to you, Ian. If there's one thing as a dad's worker.
I suppose it's a bit that if dads could go to family groups and toddler groups, they often do. But we get quite a few dads that don't, and that's in all over the place. And I think it's about just kind of approaching it a bit differently with dads. Our group, we're very informal. To be fair, I think the dads run the dads group, not me. I think I'm supposed to, but they do all the running and choose everything that happens. But it is about we're a little bit sweary and we're a little bit just men having a laugh. And if you can get dads to come along once, they tend just to stay. But it is scary just getting them through the door. So it's kind of having just to let them know it's not just the same as a normal toddler group. We're a bit different. Kind of think that helps.
Absolutely. And I think, do you know, that kind of, I think sort of having a bit of a laugh is really critical. It kind of sounds
Very
sort of
important.
simplistic, but there's so much stigma around men as caregivers and that vulnerability of stepping over the threshold, injecting a bit of humor.
Yeah.
And you know what I mean? Just kind of allowing people to have a laugh rather than being all anxious is like it's such a good piece of advice, actually. I'm glad that you brought that up because I think that's really critical. It's just having a bit of fun. Um, and you know, and it's hard for anybody who's tried to start a dad's group. It's not easy. And it
It's
takes
not.
time, doesn't it?
You know, someone just put the message here. Johnny Todd, he's one of our dad's group, and it is just about coming along. And what's really nice is you see all these dads come along who are really shy and not sure what to expect, and now they all leave and go off for lunch afterwards together, and they're meeting up outside of dad's group, which is exactly what you're wanting to do. But it is the difficulty still of just getting them through that door.
Yeah, absolutely. And I think I've done quite a lot of research into men and groups, and men and women behave totally differently in groups, and they need different things. So, yeah, but we all need friendship and we all need connection. And I think it's something that Home-Start Caithness is so good at, and just the Highlands in general seem to be, even though you're so spread out, you know, that value of creating connections and forming connections and maintaining connections is so critical to you.
I do think it's one of the more positive things about, I suppose, being in a rural location is we kind of recognize that we need these relationships where you can be in a big city, I suppose, and not know anybody. But knowing that there's not a lot of people around you, you push yourself that little bit further to make friends.
Yeah, absolutely. Before I come on to you, Carrie, I'm just going to ask the same question of Susan, actually. I mean, you are quite a forerunner, I would say, up in the Highlands. If you had to give a piece of advice to others following your footsteps.
I think for us, we obviously have referral criteria, we have limitations, that there is certain things, you know, that we can and can't do. But I think for me, dads, I do a lot of near me appointments, and dads are generally in the background, or they're there. You'll kind of hear them, or I'll see mum kind of looking at dads, and I think it's to also speak to dads as well. So I'll often say, "Oh, how are you doing?" I'll encourage mum to share my contact details with dad, even if it's in regards to mum or if it's for their own support, just to kind of get in touch if there's anything that they're struggling with or anything they want to kind of talk through. And I think it's always worth asking more than once how are dads. It's to go back and ask them the same questions that you ask mum, is to ask dads as well. But I get ask again and ask again. It's not just a one-off that you do it.
I think that's right, actually. Yeah, particularly with paternal mental health is just, you know, because we all do it, don't we? Is that we just kind of go, if someone says, "Oh, you know, how are you doing?" And you just go, "Yeah, I'm fine." But actually, just spending the time and, you know, intuitively kind of knowing that it might not be quite so okay and kind of pursuing that a little bit and just seeing whether you're getting a different answer and, you know, opening the door. Yeah, because what you don't want is for that to go missed, actually, or to miss the opportunity. So thank you very much, Susan. That's a great answer. And Carrie, you've been very patient. Thank you very much. I'll just go back to your question if I can find it. So for the people from Home-Start, I'm from Home-Start in East Lancs and was wondering how you go about recruiting male volunteers. Good question. We do try to recruit male volunteers, but it isn't something we find easy. So that's one for you, Ian, I think.
Well, that's a difficult one for me because we actually have a volunteer coordinator who does all the hard work for us. I suppose it's, again, having a small community is, I know quite a lot of dads and people that I think would make good volunteers, and it's approaching them rather than, it's great putting posters up and saying, would you like to become a volunteer? But I'll be like, he was a really good dad. I wonder if he'd like to come along and help. That's kind of where it's worked for us. But again, it's not me that does all the hard work. We have a volunteer coordinator, unfortunately. I can't take that, unfortunately.
So has anybody got any final questions? We're running a bit over time, so thank you very much for holding on for those of you who are able to. If there's any final thoughts or questions for the panel, I just want to say an absolutely massive thanks to not only the panel for coming along and taking the time out to talk to us today, but also just for everybody coming along, and particularly Johnny. I just want to say thank you very much for coming along as a dad who's been a recipient of support from Home-Start Caithness for coming along. Just a huge thank to everybody for taking the time, and I hope you found it useful. We'll be in touch. I'll speak to all the speakers, and if they're happy for us to send out their contact details, we'll come back with an email which will have an edited version of today's recording, plus all of our slideshows, that sort of thing, so you can have a wee look in your own time. But thanks again for all of your patience, and I really appreciate you taking the time out from your busy jobs and busy lives. So thank you very much.